Hello, my name is Sonia Knezovic. I'm a student at the Penn State World Campus, and I'm currently enrolled in a DMP FMP program. Today, my evidence-based practice presentation is going to address how different self-care strategies can improve burnout in oncology nurses. First, I want to start off by sharing my objectives for this project. I will first start by identifying the practice problem. I will then identify my PICO question. I will describe the literature search process. I will identify the literature synthesis, the application to PICO question, and discuss an implementation into practice. My PICO question is, how do oncology nurses who actively engage in self-care strategies compared to oncology nurses who do not engage in self-care strategies manage to decrease burnout? I chose this topic because oncology nursing is one of the areas that is most affected by occupational stress and burnout. This slide shows the literature search strategy that was used for this literature synthesis. I used PubMed as my database for this literature review. I started off with a basic search using each of the PICO elements and their synonyms. My search criteria included results from the last 10 years and articles written in English. I then combined all the elements of the PICO with Boolean operator AND, as you can see in the last row. My final search generated about 174 articles. From these, I chose 5 articles that would fit my PICO question and overall topic. I will now talk about the literature synthesis involving the design and the intervention. There were 5 different levels of evidence: a pilot study, a randomized trial, non-randomized waitlisted design, an exploratory study, and an established evidence-based program study. All the studies use a pre- and post-test type of measure. The first study by Qualls et al. Is a pre-post-test pilot study which focused on mindfulness-based stress reduction to reduce self-reported stress and improve compassion satisfaction. The second goal of the pilot study was to focus on reducing physiological indices of stress. And the findings suggest that doing a mindfulness-based stress reduction intervention before a shift can effectively reduce your heart rate, your blood pressure, and your respiratory rate. The study included the use of 8 meditations over the course of a month, where nurses had to pick either Tuesday, Thursday, or Wednesday, Friday to participate. They listened to a 9-minute long meditation, and their pre- and post-stress scores were assessed together with their pre- and post-professional quality of life scale that measures compassion satisfaction, burnout, and compassion fatigue. Duarte and Pinto Gouveia focused on exploring the effectiveness of an on-site abbreviated mindfulness-based intervention for oncology nurses in Portugal. This study included a 6-week mindfulness-based group intervention, and each session had a new theme. The first 4 sessions, participants were taught about mindfulness of the breath, body, emotions, and thoughts. The last 2 sessions were about loving, kindness, and interpersonal relationships and covered mindful communication. The randomized controlled trial by Hilkov et al. Investigated effects of a mindfulness-based yoga practice on stress, burnout, and indicators of well-being among nurses and healthcare professionals. Blackburn et al. Showed an established evidence-based program that was first started in 2016 and has been conducted 10 times so far. The Thrive program is an 8-hour retreat designed to teach self-care strategies, followed by a 6-week private group study interaction on social media, and then a 2-hour wrap-up session. Lastly, the study by Kravitz et al. Developed and evaluated a psychoeducational program that assists nurses in developing stress management plans. The intervention included a single 6-hour class with relaxation, guided imagery technique, art exploration of proactive coping strategies, and creation of a personalized wellness plan. The population for most studies included oncology nurses. However, there were 2 out of the 5 studies which had a variety of other healthcare professionals like nursing assistants, therapists, physicians, social workers, and nurse practitioners. The study by Kravitz et al. Was the only study which included new graduate oncology nurses. The study by Duarte and Pinto Gouveia recruited oncology nurses from 2 major oncology hospitals in the north and center regions of Portugal. The sample population of the participants varied anywhere from 13 to 248 participants. Now let's talk about the different results yielded by these studies. The study by Qualls et al. Demonstrated that mindfulness-based stress reduction is effective in managing stress, reducing compassion fatigue, enhancing resilience, and limiting the effects of burnout in oncology nurses. The participants experienced a statistically significant decrease in self-reported stress scores at all 8 sessions. The researchers used the Professional Quality of Life Scale, which showed that after the MBSR intervention, nurses reported moderate level of compassion satisfaction and low level of compassion fatigue. Lastly, the only physiological indice that statistically decreased was the systolic and diastolic blood pressure. The nurses experienced a statistically decrease in systolic blood pressure in 5 out of the 8 meditation sessions, and a decrease in diastolic blood pressure in 3 out of the 8 sessions. The study by Hilkov et al. Is the only one that used mindfulness-based yoga, which showed an improvement on stress, burnout, vitality, sleep, quality, serenity, and mindfulness after the intervention. Another study by Kravitz et al. Used the Maslow Burnout Inventory, known as MBI, to identify a decrease in emotional exhaustion and depersonalization. The personal accomplishment on the MBI score went from 45% before treatment to 55% after treatment, which reflects a relaxing of personal defenses in response to the intervention. The emotional exhaustion score on the MBI showed that high levels of exhaustion occurred in 37% of the participants before and in 27% of participants after the intervention, meaning that there was a significantly lower emotional exhaustion score. The depersonalization score assesses feelings of being removed from and or distant from the work experience. A high DP score is an indicator of burnout. The high depersonalization score was 13% pre-intervention and 10% post-intervention, which means that there was a significant effectiveness of the intervention. Now, the Thrive program resulted in an increase in resilience and decrease in burnout of oncology nurses. The increased resilience scores were sustained for a 6-month period after the nurses participated in the Thrive program. I would like to talk about the application for my PICO. So the intended population of study was oncology nurses. However, the tested population in the articles were oncology nurses and other healthcare professionals. The intended intervention was self-care strategies. However, the articles showed that mindfulness-based stress reduction in the form of yoga classes or retreats can be used. Also, a psychoeducational program was used. The comparison group should have been no self-care strategies. And lastly, the intended outcome should be reduced nurse burnout. And the articles tested more than just reduction of burnout. It tested reduction of compassion fatigue as well, improvement in sleep, vitality, serenity, and mindfulness. Now, let's talk about the implementation for clinical practice. I would like to implement a pilot study. I want to collaborate with oncology nurses on my unit and the nursing leadership team. I want to use a mindfulness-based stress reduction intervention and use the wellness room on my unit. I want to assess both burnout and physiological stress. I would like to use the Maslow burnout inventory scale and the professional quality of life scale. I also want to create awareness on the importance of self-care in the workplace and at home. In conclusion, now let's talk about what the articles mentioned for the implication of practice in nursing. One of them mentioned that MBSR can be used to develop interventions for other nurse populations. This is an area of further study. Another one showed oncology nurses can implement mindfulness-based stress reduction interventions outside of work. There can be a creation of applications that can incorporate meditation-based stress reduction to help monitor own self-care. There can also be a creation of the Thrive program just for nurse leaders, and another program can focus on the relapse and recovery of burnout in nurses. As you can see, here are my references. Thank you so much for listening and watching my presentation. If you have any questions, please feel free to email me. Thank you.